My name is Olive Burrows and welcome to the Nation Leadership Forum. This evening, we'll be discussing a subject that affects a constituency in the millions, and that is the impact of COVID-19 on education. A subject matter that touches on just about everybody, regardless of whether you're a child, parent, or teacher. Before I unveil my panelists, let's take a quick look back at the events that have brought us here. On the 15th of March, exactly 67 days ago, which translates to 2 months and 6 days, President Uhuru Kenyatta suspended learning in response to the COVID-19 pandemic.
We have suspended learning in all our education institutions with immediate effect.
On the 23rd of March, President Kenyatta announced that the government was developing a program for education to continue at home.
These balloons, which will hover well above our commercial airspace, will carry 4G base stations and have the capacity to provide wider signal coverage.
Unfortunately, in this country, it is the children at Brookhouse, at Sabis, at Braeburn, at Braeside, and other English-sounding schools with English-sounding names. Those are the children who are learning. The majority of the 15 million children in this country are sitting at home idling. Could the committee find out why, after spending 100 billion Kenya shillings to provide laptops for children in the Republic, we cannot continue to provide electronic and virtual learning to the children of this Republic?
On April the 26th, the Education Cabinet Secretary George Magoha announced an extension on the suspension of learning to June the 4th.
In the interest of the safety and lives of our children, our beloved children, the government has decided to extend school closure for 1 month, effective from the date of opening. At this point that I'm speaking to you, the government has not decided to postpone both the Kenya Certificate of Primary Education and the Kenya Certificate of Secondary Education.
Realistically, we must accept there is no education going on. And so we must get to a point as leaders, because leadership includes facing reality, that certain very radical measures and pronouncements need to be made about this year's education calendar.
In our country, at the state of development where it is today, it is very true that it is not possible to give online learning to every child. And I have said, in order to be fair to all the children, who in my opinion must be treated equally, when we open, we shall ensure to the best of our ability that the children cover what they lost.
And on the 12th of May, Magoha appointed a committee to, quote, take charge of the process of exploring the best possible strategies of restoring normalcy.
If, on the other hand, the situation becomes completely out of control, then we shall have to bite the bullet. The children are alive and they are at home. So what? They are at home and they are safe and they are alive. And if it means that they have to stay for a year, so be it. It is not only in Kenya where this is happening.
And that bell signals the start of our conversation, and I want to encourage you to take part in the discussion and join us virtually. Also join me virtually at this time for panelists. That is the chair of the COVID-19 National Education Response Committee, that is Sarah Ruto, the Vice Chancellor of the University of Nairobi, Stephen Qiyamah Gitahi, the CEO of CASNEB, Dr. Nicholas Leting, and joining us from Eldoret is Associate Professor of Moi University, Charles Ongondo. I also want to encourage you, as I said at the top, to take part in the conversation. How do you do that? Use the NTV Kenya handle on Twitter. The hashtag is NMG Leadership Forum. Now let's take a closer look at our panelists' credentials, and I'll start with the lady, Dr. Sarah Ruto. She is, as I said, the chair of the COVID-19 National Education Response Committee, and she is also the chair of the Kenya Institute of Curriculum Development. She is also chair People's Action for Learning, PAL Network, a former regional manager, Wezo East Africa, former lecturer at Kenyatta University, and she sits on the UNESCO Advisory Board on Education. All right, next we have Professor Stephen Qiyamah Gita. He is the Vice Chancellor, as I mentioned, University of Nairobi. He is a former Deputy VC, Human Resource and Administration at that university. He acted as Deputy VC, Finance Planning and Development. He also conceptualized and actualized the Wangari Maathai Institute for Peace and Environmental Studies. He chairs Utafiti Primary School's Board of Management in Makueni, and he also served on the BOM of Gatugi Girls Secondary School in Nyeri. Next is Dr. Nicholas Leting. He is the CEO of the Kenya Accountants and Secretaries National Examinations Board, that is CASNEB. He is a former VC and CEO of Management University of Africa, as well as a former council member of the KICD, Kenya Institute for Curriculum Development. And up next is Professor Charles Ongondo. He is an Associate Professor, Faculty of Education, Moi University, and he's also a member of the Task Force on Curriculum Reforms Implementation. He has 10 years' experience as a secondary school teacher and principal as well. And I might not have your credentials, but you're also part of our panelists this evening. Do not forget, at NTV Kenya, we will be looking at your responses. I have some already from the interaction we had earlier. I'll start with you, Dr. Ruto. You're in charge of the committee that's been tasked with guiding us back towards normalcy as far as education is concerned. Where do things stand now?
Thank you for having me as well. We must remember what brought us here. There is a health pandemic, and that is the most important thing that we must be faced with and ask for expert evidence that will allow us and inform us on the decisions. And this is because the health first maxim has to remain steadfast in whatever else we are doing. Secondly, we know that the voice of the people is very important. These are people's children we are talking about. They have a stake in this. And that is why we decided that we have to call for submissions. And as we speak now, couple thousand have been received. That is very important and will also inform any decision that we need to make. Third, and very important, we are not alone in this. And there are many people who are thinking about it, international literature from the global north, global south. That too is informing us. So that is where we start. We stand as a committee that is thinking about and steering this process.
Okay, Professor Qiyamah, I'll ask you to come in now. Where do the operations of UON stand at now as far as the COVID-19 pandemic is concerned?
Thank you very much, Olive. The University of Nairobi closed briefly for about 2 weeks to plan on how to operate or to ensure continuity even in the face of social distancing. And after we planned, we trained our staff, we trained our students, and now we moved into remote online teaching, which we have been doing. And now we have started also the issue of examination for postgraduate students, masters, PhD, and also now moving on to undergraduate students. So we are completed on course in our program now, teaching. Yeah.
Right. I'll take you to task a little bit over the virtual learning. When you rolled it out initially, there was some resistance. Have you ironed out the issues that had ruffled a few feathers?
Yes, that is to do with the issue with the teaching. Come up again. I didn't get that question very well.
As virtual learning is concerned, there was some disgruntlement from students when you first started in terms of access and accessibility and also ease of the virtual learning process. Have you ironed out these issues?
Oh, yes. Oh, yes. Oh, yes. You see, those things are very expected. Anytime you have an innovation, you expect that in a population, you have the early innovators, the early adopters, the late adopters, and then the laggards at the end. That is always something expected. So whenever you are bringing a change, an innovation in a population, always expect this. So we had a bit of issues, and it is the most important thing is to be able to listen to what the people are saying. Because when you listen, then you are able to respond appropriately. So as a university, we listened and we discovered that there are many issues about the planning of those lectures, the teachers, what is level of their knowledge of managing those things, the issue of data bundles, what do we do? And then we agreed on what to do. We provided data bundles to students. We provided training to both students and staff on the various platforms that could be used for online teaching. So we were able finally to overcome to some extent to begin business in the university.
All right. Speaking of teachers, or rather the lecturers, and they are being prepared being readied to get into the world of digital learning. Let's hear from Professor Ongondo. He's a trainer of teachers. Professor, do you think our teachers were properly trained as far as digital learning is concerned? Or let me start with this question. Do you train teachers on digital learning at the Moore University?
Thank you, Olive. I didn't hear the others very clearly, and there's still a lot of echo from your end. But I've got your question about whether teachers are properly trained for digital learning. And I would say no. Our teacher training has not normally had the digital learning component in it. What we have had in a number of teacher education programs is what we call integration of information communication technology. But again, because of the lack of appropriate resources, that has not quite taken root. And even those who have been trained, upon being posted, a number of the institutions where they serve do not have those facilities, so there have not been any opportunities for them to use them. So this is a time for us to think about infusing ICT in teacher training, online platforms more strongly, but it has not been strongly there before.
All right, thank you, Professor. Now, Dr. Leting, what is your position as far as resuming learning is concerned? There are those who propose that as a pilot, we start with the tertiary institutions. Do you agree?
Thank you very much, Olive. Good evening, viewers and Kenyans. We'd like to say that CASNEP is an institution that was established 50 years ago in 1969, and has been offering examinations on business to business professionals in Kenya and globally. And so we believe that as a tertiary, we examine students who are at tertiary institutions, post-secondary education. And so what we do is that we normally do have 2 sittings in a year, in May and in November. So one of the things we have been, by next week we are expecting to offer examinations towards the end of May, for the sitting of May. And so what we are doing is that since March, when the leadership of our country, the President of Kenya, declared that all institutions of learning are closed indefinitely, it also affected our examination programs. And so it is going to affect most of the institutions as well, where our students are trained or they go for tuition in mid-level colleges or tertiary institutions, and including some of the universities that offer CASNEP examinations that include CPA, certified secretaries, investment and financial analysis, credit management, among other courses. And so as an institution that is a global leader in examination for business professionals, we are affected adversely, but we have also, we thought of developing strategies to reach out to our students through webinars so that they can remain focused, so that the time when this country will be declared COVID-19 free, we shall be able to administer the examination as and when the students are ready. Thank you.
But what of my question, I asked you, what do you make of the proposal that perhaps when we start to reopen institutions of learning, we start with the institutions of higher learning?
Thank you. Indeed, what we need to do is that when you look at other countries. I think France started by offering, allowing students in basic education to go back to school, among other countries. And the experience there was that there are some upsurge of about a number of students have been reinfected by the coronavirus. In Germany, there have been incidences where the higher education sector was opened first, subsector. So you notice that it is easier for adults to manage social distances, so that as they study, it is possible not to. If you allow young children to go to school, there may be incidences when they can even throw away the masks, and they may infect themselves unknowingly. But for adults, you tell them to maintain a social distance of maybe 1.5 meters or 2 meters, they can easily do that because they are mature people. So my thinking is around where we encourage the ministry or the government. We are in government, so we want to propose that we can consider starting at the tertiary institution, universities, masters, PhD, and even colleges, mid-level colleges that offer professional courses, as long as they are ready. I remember that in March, there were the NEC examinations that were supposed to be done in March, but of course they were suspended because of the COVID-19. There are also examinations that are due in June for NEC and also for CASNEP. So we think that if that was to be allowed, even if it is staggered in a manner that allows safety and health of protection of every person that will be there within the guidelines of directives of the Ministry of Health, in consultation with the Ministry of Education and the various organs of government, I think that is the only way that we can be able to ensure continuity of learning. I was just watching earlier on, Tanzania has already ordered that schools go open from universities and tertiary institutions from 1st of June. I think as a country, we need to be able to assess our situation and see what we can do, starting from the tertiary institutions as we go down. Thank you.
Thank you, Professor Qiyamah. What's your take on that proposal that perhaps, I know you have the virtual learning going on, but would you support or do you support the proposal to have tertiary institutions open first before the basic learning continues?
I would not propose to have the tertiary education open first because you see, until now, we have not understood this disease very well. There are still views that says that those who are young are affected less. We know that the university students will interact in the hostels, interact in the lecture theaters, and after that they go to live in all estates, like in the University of Nairobi, for example, all estates in Nairobi. So if there is a problem from one of our hostels, this can go to the lecture theater, and after that go to all parts of Nairobi. So we would be cautious to go this direction. I think where we need to begin is to begin with the lower levels of primary education, especially the day schools, even secondary day schools, because those people, they go to a school where it's a walking distance from where they stay, and you can, if there is any problem, you can be able to ring it and be able to identify where the problem is and attend to it. But not in diffuse institutions like higher education where people stay in all kind of places. But in primary school, which are day schools, or even secondary school where they are day school, it's possible to open and begin and then see how it goes and then step by step like that. Yeah, but tertiary education, they should be the last. In any case, with the tertiary education, it's very easy for them to begin adopting the issue of online teaching or remote online teaching. Because in any case, we are training our young people for lifelong learning. So if you begin now to use technology to access your information and to interact with your colleagues for tutorials, for seminars, for discussions, for teaching, if we just inculcate this culture, it means that when these people leave the institutions, they will continue using that soft skill they have learned, and that the country will be better. We will not be having people who just read newspapers or listen to stories being told by people. You also get a chance to read the new information that has come, whether it is coming from Moscow, it's coming from New York, it's coming, wherever it's coming from, using online platform. So we are looking at this as an opportunity to open those in tertiary education for access to information beyond what they can get from their lecturer who stands in front of them. In any case, we are also providing opportunities for lecturers to invite someone from another university to come and also contribute to the class as a visiting lecturer. You have this 1 hour lecture you are teaching, and then you can invite somebody to teach for 10 minutes, 15 minutes to co-teach with you. So these innovations, we are using this issue of COVID as an opportunity to leapfrog to where we had failed to do for a long, long time as tertiary education institutions.
All right, thank you, Professor. And of course, that raises then the question of access to this technology, especially where primary and secondary school learners are concerned. We will be addressing that after this break. But first, as I mentioned, you are also part of the conversation. And this is what Esther Waigumo proposes. She says Form 4 and Class 8 should be allowed to go back to school. The manpower and infrastructure is enough to practice social distancing. That's her proposal. We'll hear from Dr. Ruto after this break.
Continue to behave normally, this disease will treat us abnormally.
Basic protective measures as guided by the World Health Organization. Clean hands frequently with soap and clean water. Cover nose and mouth when coughing and sneezing with a tissue or flexed elbow. Avoid close contact 1 meter or 3 feet with anyone with cold or flu-like symptoms. If you have fever, cough and difficulty breathing, seek medical care early. Avoid raw or uncooked animal products. Help the world put an end to the spread of respiratory diseases by sharing this message with a friend. Message brought to you by Sour Herbal Family Bath Soap. There's no debate. Home is best. If you must pay for deliveries, use your NCBA debit card. Stay home. Stay safe.
For a better tomorrow, don't forget to do the 1, 2, 3 with Colgate every night.
Continue to behave normally, this disease will treat us abnormally.
Glad to have you back. You're watching the Nation Leadership Forum, and that is on the impact of COVID-19 on the education sub-sector. Dr. Ruto, before we went on break, I read you a proposal by Esther Waigumo, and she suggested that candidates be allowed to go back to school. Earlier, I had asked Professor Qiyamah as well as Dr. Leting what they make of another proposal that tertiary institutions go first. What are some of the proposals you've received, and what are you considering?
Unfortunately, I cannot answer that question because, as I told you, we had asked for submissions. We close the submissions tomorrow. So please allow us to receive all the submissions, analyze them, and they will give us an idea of where to go. Indeed, these are some of the suggestions we are receiving, and they will be treated with the merit that it deserves, looking at what also the various studies are telling us about what we need to do.
So when can we expect you? You say the deadline for submissions closes tomorrow. When can we expect you to provide some guidance on this question?
The Minister of Education extended the holiday or school closure until the beginning of next month. He obviously has to address the nation, and we were constituted in order to advise him. So these are the timeframes that we are working on. And again, unfortunately, while I cannot give you the exact time, I can just assure you on the processes that we are taking, which are very methodical, in which we are ensuring as much as possible to consult, listen to the voice of people, listen to what science is saying, so that we can give the most rational, best decision that will be good for the children, for the country. Because we must be aware that if we are talking about starting schools, then really we are talking about restarting the economy. And yet we are at the moment in certain containment measures. So it is a very delicate situation, but we have adequate advice that can allow us to be able to be very thoughtful in the advice we shall provide.
All right. Part of what CS Magoha, as you said, he extended the suspension of learning to June the 4th, and he went ahead to clarify as far as a second term is concerned. Earlier, he'd said the plan was to shorten the holiday period in August and then extend the period, thereby extending the period for learning. And he also talks about shortening the period for the break. Dr. Ruto, are you able to tell us how the COVID-19 pandemic has impacted the rollout of the CBC?
One of the things I have been hearing, which I must say somewhat puzzles me, is when people say education has stopped and learning has stopped. I think we need to debunk that notion. Unless we are boxing learning into just academic learning. The competency-based curriculum from the very beginning has based its premise on offering a wholesome education to a child, that it cannot just be cognitive, that the parents are very important. And therefore, let me address that one part that is really alive when we are talking about education in its broader sense today. Perhaps for the first time in a long time, children are with their parents or guardians for a long time. There are many things they will observe from them, which cannot be even done as well in schools. Values of responsibility, of empathy, of reaching out to the other. So these are things that are core, as important in the competency-based curriculum as academics are. Secondly, and somehow nobody has connected this. If you remember last year, around third term when there was a national assessment going on, one thing that captured Kenyans' attention was that children were in markets and they were cleaning. Please go back and get any photo. If you look at any of those photos, those children were wearing masks. Those children were, or face clothing, whatever you want to call them. Those children were wearing protective gear. They were learning skills that will allow them to be. We hadn't known that COVID-19 will come. And today, if you ask a child to make something, there's something they were taught in school, because the curriculum is one that is not just focusing on the academics, but is broader. So the competency-based curriculum to me is alive, and we need to give it an opportunity to allow us this wholesome education that is what we need to give all our children.
All right. You say the competency-based curriculum is alive. You say learning has not stopped. Children are learning from their parents. But as far as a curriculum has a program of what should come when and what should follow what. So in terms of the math, the science, the religious education and all that, how has that been impacted? Because research has shown that up to 78% of Kenyan children are yet unable to access the digital learning tools that the Ministry of Education and President Uhuru Kenyatta say are available.
I agree the digital divide is very wide, and the various research pieces we are getting are also very wide. I think it is because it depends on the population that you are reaching, and that is why rapid surveys are very important. It is true the curriculum coverage, as would happen with the teacher in class, cannot be expected to be the same, and that the radio lessons, TV lessons, various online lessons that we are seeing, and by the way, very many Kenyans have come up with a lot of agency to see what they can do. Obviously, that cannot replace what the teacher does, and I think it is not intended to the parent to be a teacher, because that is not what they are good at. However, they can allow gainful moments of learning that is to the best of their capacity. Or they can even play the role of asking the child, so what is it that you learned? And when a child repeats them, they're able to do. So one of the things that we are talking about is that perhaps we need to be talking about parental engagement, empowerment first, what a parent can do in their comfort zone before we talk about this, engaging this parent to do various learning situations. I absolutely agree there is a digital divide that is there, but I also believe that it is something that we can address if we put our mind to it.
All right. And I don't expect you to answer this question, but speaking of the digital divide, something that has come up as far as the comments are concerned, we even had Senator Moses Kajwang raise it, saying the government had promised laptops and what happened to that endeavor. But Dr. Ruto, what you can answer for me is how can parents or teachers access the digital learning tools we've been told have been made available by KICD?
The digital learning or digital devices that are in school?
Sorry, digital? The digital.
What was your question?
The digital learning, the material, the resources. How can parents, how can teachers access them?
So allow me to wear my hat as the chairperson of Kenya Institute of Curriculum Development. We have about 3 modes, and I will start with radio, which has the potential of being accessed in further places. And this is one form. And next we have TV lessons, which are going on in Edu Channel. And various other stations are also airing those lessons. And then thirdly, we have the Kenya Education Cloud, which to me is the potential of the future. At the moment, it is still acting as a repository. Then obviously, almost all these lessons are available on YouTube so that you can access them when you want. But let me again say something about radio. When the radio lessons were created, they were created with the notion that the teacher is there to support learning. And so what we are saying, which is again the agency of Kenyans, is that you will find that they sometimes get whom they think is the best physics teacher, best chemistry teacher, to go to a radio station. And then after the radio station lessons have been aired, this teacher remains on at the invitation of the radio stations to talk with the learners. So quite a bit is going on. And I think, why don't we also focus on some of the good things and the agency citizens have shown to make it work for all, rather than always looking at our glasses half empty.
All right, I'll come back to the radio and the TV and what the plan is with that. One senator, I think it's Senator Sakaja, had raised the point of, you know, in the morning it's class 2 English, in the evening it's physics, you know, just the coordination and the planning as far as that is concerned. Professor Ngonto, I'd like to bring you in at this point. You were a secondary school teacher and a school principal for 10 years before taking up your position at the Moi University. NAT and CUPET have raised concern that teachers have not been sufficiently included in the conversation as far as remedying the COVID-19 impact on the education sector is concerned. Is there merit, in your opinion, to those voices?
Thank you very much, Olive. I think there are two ways of looking at it. One is that, yes, the teachers' unions deserve to be heard, deserve to be given an opportunity to contribute to the debate that is going on. But the other side of it is that that opportunity need not necessarily just be looked at in terms of membership in the committee that was constituted to advise the Cabinet Secretary. As far as I know, the committee invited all Kenyans, all stakeholders to submit their views so that we can all contribute to whatever decisions will be made. And I am aware that CUPET has already made that contribution. The Kenya National Union of Teachers could also submit their views. But I want to extend the debate further and say that one way the teachers could be involved to build upon the platforms that Dr. Ruto has explained is that we can think about how to involve teachers from where they are to engage learners further. So my suggestions would be that we start thinking about adding on to the radio, the television, the education cloud, the YouTube, by possibly asking learners to register in the nearby institutions to where they live, then involving teachers in those institutions to find ways of occupying them in turn, so that at any one time, we just have a group of a few learners in an institution, and then teachers can try, even if they just went to those schools once in a day, to support what they have learned digitally or what they may not have got, and to engage them in other activities that could take them further, using what one would call innovative pedagogy. So that would be my response to the wish for the teachers to be involved further. A number of teachers I've talked to have intimated to me that they are tired of just sitting at home, being idle, and so they think they could make a better contribution. And that better contribution, in my view, could be to ask them to support learning from where the children are, avoiding the crowds, avoiding the normal classrooms. But how is it that we can involve them to support learning where they are, even if it means in a day just having about 50 learners coming to an institution and being given tasks that they could do in the rest of the week that build upon what they have learned electronically. That would be my response to that.
All right, thank you, Professor. I'll bring in the other professor in the room, and that is Professor Qiyamah. One issue that that people have been very vocal about is the issue of fees. I'll start with, is UON charging the full fees?
You see, Olive, when we charge fees, the fees is not for renting of the spaces in the university, the lecture theaters, and the compound and the facilities. The fee you charge, it is just to facilitate your learning. And this is to support the professors to be able to teach you. So that is, and obviously also that's why we are providing, including the data bundles, to ensure that the professors are facilitated to teach the students. So the fees they pay is the same fee they pay if they are attending the lecture in the lecture theater, because now they are being taught remotely through technology, and that technology, there is investment in preparation of the teacher, the time they have used to prepare, because you know we have to still pay the salaries of those teachers as they teach, as they prepare, and even on the use of the platform that they are using now, the telecom data bundles and Safaricom and the other data bundles we are providing. So the fees is the same, yeah.
All right. Dr. Leting, I'd like you to come in at this point. You're a money man, or rather you oversee an institution that deals with trading as far as those who manage our money are concerned. Do you think after the COVID-19 pandemic is through, however long that may be, will we see increased funding of research? We saw KU develop respirators. Will we, in your mind, do you see people investing or taking research much more seriously?
Thank you, Olive. One of the things that we need to appreciate is that the Kenyans are very good in research. They are good in almost everything. We are the founders of M-Pesa. We are the ones who innovated M-Pesa. So I know, and I sit on the board of National Commission for Science, Technology, Innovations, NACOSTI. And one of the research priorities has been to support the health sector in terms of providing opportunities for researchers. And if you look at, we also have a body called the National Research Fund that funds research. And it has been, normally it's supposed to be getting, to be funded to the tune of 2% of the gross domestic product in Kenya's budget. And so I look at it like this. If on the short term, there is need for the institutions of higher learning in conjunction with professional bodies like the Association of Professional Societies of East Africa, because in that body, there are a number of professional institutions. For example, the Institute of Certified Public Accountants of Kenya, among other bodies, can also partner with the bodies that are there to undertake research. I was just reading about India. India has decided, the Ministry of Education directed all universities and higher education institutions to undertake research, for example, on how the Spanish flu of 1918 was managed. So it will call upon, in the case of Kenya, a multidisciplinary approach, multi-institutional approach of research, where you bring Kenyatta University students or scholars to Nairobi to interact with the University of Nairobi, to interact with accountants, to interact with lawyers. In other words, have a multi-agency, multi-disciplinary approach to research. For example, if historians would be involved together with biologists and chemists and health scientists and accountants to come up with a model that will work for Kenya, I'm sure it can come out. But unfortunately, sometimes we do not have a way of coordinating the way things are done in our country. If we can do that, I would expect, for example, that's why I said earlier on, universities could be challenged and tertiary institutions could be challenged to come up with even some alternative medicine in terms of how do we attack this coronavirus 19. Because we have scholars, we have scientists, we have professors, we have engineers, we have people who can be able to come up with solutions that meet our current and future needs. If you look at the inventors of the time, like for example, when I read my history, we are reminded about Isaac Newton. During the time in 1665, during a long vacation, I think there was an outbreak like this one. That is the time he discovered the forces of gravity. And perhaps this is a time also when our students, and I know KICD, the CBC curriculum is meant to be student or learner-centered. And I know Dr. Ruta has actually reminded us about that. Perhaps this is a time we could challenge our students, the young people, the ones in high schools and primary schools, to come up with an innovation that can help even the teachers to know how to reach them more. I see a number of use of technology currently in use of Zoom, among other approaches like Teams, to communicate. The government has directed that boards can have meetings using technology, virtual technology. And so therefore, it is possible to have research virtually with institutions, multi-institutional bodies working together through the associations that are there. A Professional Societies of East Africa is one of such body. NACOSTI is one body where we can be able to work together with KICD and other bodies like now the tertiary institutions that we train students to become self-reliant through entrepreneurship. Thank you.
All right, thank you, Dr. Letting. And Dr. Ruto, when we come back from this break, before I read a quick comment that's come in, I'd like you to address the issue of, you know what I asked Dr. Letting about research and all that. Has the COVID-19 pandemic heralded a new dawn as far as learning is concerned? How will it inform moving forward your curriculum and your training of teachers? And did you factor in e-learning when you were training teachers on the competency-based curriculum? All that and more after this break. But first, let's see what Eva Soni has to say. And she says reopening of schools can wait a bit. The virus is still spreading. Even if they reopen, very high absenteeism will be the order of the day. Parents will fear taking their pupils to school, and if no measures are taken to instill proper social distancing, sanitizing and regular hand washing, then absenteeism will be due to sick children. The disease is still new, so not much exposure, therefore no high immunity.
All day, we expect our mouth to do all kinds of things. That is why it needs all-round protection. New Oral-B Pro Health toothpaste. Its advanced technology helps prevent both tooth holes and gum problems that can lead to tooth loss. It strengthens your teeth, giving them all-round protection. Because your mouth is doing more than you think. New Oral-B Pro Health. All-round protection for your whole mouth.
Disinfect and protect your home with Jik. Jik kills 99.9% of illness-causing germs. Disinfect floors, kitchen and bathroom surfaces, and wash white clothes, towels, and dishcloths with Jik bleach. Just Jik it.
Do your gums hurt? Yeah. Does your toothpaste contain sage, eucalyptus, myrrh, chamomile? All that in one toothpaste? Yes, try Colgate Herbal. Colgate Herbal contains nature's best herbs and Colgate's fluoride technology to give you strong teeth and healthy gums. Ah, Colgate Herbal. Let's go. Colgate Herbal for strong teeth and healthy gums naturally.
Birthday party.
Birthday party. Birthday party.
Birthday party.
Are we not invited?
We have gifts.
Malaria.
Mommy, pests.
Rat.
Oh, die.
Party.
Compared to an ordinary spray, Mortein Doom Power Guard kills disease-causing pests instantly. Mortein Doom Power Guard.
Nyaje wa Kenya. Hii ni public service announcement kuhusu coronavirus.
The Ministry of Health advises all returnees from abroad to self-quarantine for at least 14 days, whether they feel well or unwell.
Wash your hands regularly following the 8 steps of hand washing. Wet hands with warm water. Apply a small amount of soap. Rub palms together. Rub fingers and thumbs and the bits in between. Rub nails on palms. Rub the back of each hand. Rinse with clean running water and dry thoroughly with a clean dry towel.
Furthermore, it is advisable to cover your mouth and nose adequately when sneezing or coughing and immediately dispose of the tissue in a dustbin. Please do not use handkerchiefs if you can avoid it. If disposable tissue is unavailable, cough into your elbow. Try and avoid close contact with anyone showing signs of respiratory illness, such as coughing or sneezing.
Before you share any coronavirus information on social media, please verify it with Ministry of Health to avoid panic and alarm among your fellow Kenyans.
Mama, how can we stop coronavirus?
We can fight its spread by washing hands with soap, like a geisha bar. Stay strong and go so far.
Be strong and last long. Like geisha.
Disinfect and protect your home with Jik. Jik kills 99.9% of illness-causing germs. Disinfect floors, kitchen and bathroom surfaces, and wash white clothes, towels, and dishcloths with Jik bleach. Just Jik it.
Kira! Kira? Where are you?
Malaria!
That's why you need the superior protection of Mortein 360-degree reach. Only this has 11 fans which enable it to reach the farthest corners. Mortein, total indoor protection.
Want to get it all, even on your period? Now you can. 9 out of 10 women who tried our product love it and will buy it. New, always 2-in-1, feathery soft top sheet, and super absorbing channels. We are generation of change, always.
Those that are born with club foot, which is a congenital deformity, face immense stigma due to misinformation for a condition that can actually be corrected. Now, children born with this condition are ostracized, labeled bad omens, or products of witchcraft.
Growing up with clubfoot has been very tough. I never used to remove my shoes at all.
We shed light on this condition and of course bust some of those myths and also understand how you can correct this condition.
This is the time to make sure every table in Kenya has food on it. Dial *126# to transfer your bonga points now so they can buy food and necessities at any outlet with a Lipa na M-Pesa till.
Safaricom is for you. This is NTV.
Tonight, Kibra may soon be placed under containment as Kenya hits a new record of COVID-19 positive results in a day. It may get worse.
We have recorded the highest number yet again at 80.
In which case we'll be reporting about 200 plus cases per day.
The government responds to the church's prayers. Plus, testing 1, 2, testing vaccines. Will the dream come true?
We go in with a lot of hope that we'll be able to develop an intervention, and we want to believe that a vaccine will be found soon.
Kenya looking for a solution to the coronavirus disease. Also tonight, Jubilee, a party apart with the iron fist rule growing the rift.
We are being led back to a gunpoint, to a place we swore never to visit again.
It is my work as a whip to enforce discipline in the party.
Senators directed to attend voting session and ensure they kick out Kithure Kindiki as deputy speaker. And the stadiums and their track records, another one to be built in Kisumu.
And so we'll be joining them. We hope that we'll get a report from them very quickly so that we can embark on doing what we were directed by His Excellency the President to do.
Another performance in the theatre of promises or pronouncements that will be tangible on the ground.
The risk of illness-causing germs is increasing. It is believed that the coronavirus can remain on surfaces in your home for up to 9 days. Touching infected surfaces is one of the ways in which germs spread. Regularly disinfect your floors, countertops, and kitchen surfaces with bleach. And use an effective toilet cleaner inside and outside your toilet bowl. This message is brought to you by Medifact, JIG, and Harpic.
Welcome back to the Nation Leadership Forum. We are discussing matters education, more specifically the impact of COVID-19 on education. Dr. Ruto, I will start with you. COVID-19 appears to have heralded a new normal. Was KICD ready for a situation such as this, where you're only able to access learners remotely? You spoke of radio, you spoke of TV and YouTube. Were you ready?
In a sense, yes, because everything that we are doing, we did not start afresh. We simply expanded it. We acted with more urgency. Take, for example, radio lessons. They have been there since the 60s, the 70s. Yes, they were there to supplement, but now they became the main thing. And so we therefore went into negotiations, expanding the hours. And I think the ideal would have been to have various frequencies, where one is specifically for lower primary, another one upper primary, another secondary. At the moment, they're sharing. And if you do not know that we are mainly packaging radio lessons for the young children in the morning, followed by upper primary, then secondary, then you might be looking for the wrong thing at the wrong time. But we did not start. We expanded it. We went on with agency and urgency.
Okay, all right. Were the teachers prepared, such as those who are providing classes online, for instance, when teachers were being trained, did you incorporate elements of digital or e-learning?
Let me take the example from the competency-based curriculum. One of the key competencies in CBC is digital literacy. And that is why the DLP program was a very important one. And that is why sister agencies have been training teachers. And that is why we in KICD have a program known as Elimika, which has graduated several thousands, admitted several thousands. And these are teachers who are joining at their own volition to improve their digital skills. So it is a core competence. And even now, when we are talking about creating designs for teacher training, COVID has just confirmed that what we were doing was the right path. And if we are reimagining education, we cannot think about it without the centrality of EdTech, without e-learning being a platform in which if a problem happens, like the flooding we have, then children do not stop learning. We know that formal education is so very important in allowing children a sense of normalcy, and technology can afford us this possibility. So what is going to make it easier is that even in our educational planning, it was already there. So what we need to do is to sharpen our thinking and to retain that focus that we had started when we started reforming this education, and identify digital literacy as important as any other competence. Like learning to learn is a competence which is very much alive in CBC, and which Professor Qiyamah has faced when he had certain people feeling that they cannot go into e-learning. This means that you have to have the competence of knowing that we are moving in a fast changing world. COVID, who knew this would happen? So we must always learn to learn. So it was there.
All right. I know you said you're still receiving submissions on when schools should reopen and in which manner they should. But Professor Magoha said when he was at Senate, he said, if this thing goes on for a year, then we really need to be considerate of our children's health more than them physically being in the classroom. Are you prepared for a longer term situation? I know you mentioned that as at now, the extension of the suspension goes until June 4th. Is KICD prepared, especially with the data and the reports that are coming out and saying access to the formal education? I know you said children are learning from their parents, but access to the formal education is not as widespread as we would like to imagine. And the CS education also acknowledged that fact. Are you prepared for a longer term of students, learners being out of the classroom as KICD?
There is a lot of energy going on in the institute, and obviously we have to up our game. And the public has a right to expect much more from us. Like I mentioned that the Kenya Education Cloud has a lot of potential. And that is an area in which we have to invest much more, and also not just from putting material, but also communicating with parents on the possibilities that are there. So a lot more can be done, and we are going to up our game. But it is not only KICD. there are so many individuals and institutions in Kenya that are doing something. So one of the things we have also decided, and we just started on a rapid survey, was to understand what kinds of innovations are there. And the survey told us that there are many people are choosing learning through their mobile platforms, their phones, WhatsApp classes, Zoom, whatever you call them. And if this is what is more accessible, then even as an institute, we need to expand and not just think about radio, TV. They are very important and they will remain and they're playing their role, but we need to also go where Kenyan parents and children are so that we meet them. So the Institute is there to do this, and it will do its part. It cannot do it without also gathering the effort and solutions from other Kenyans. And we feel that is also a very key role that we can play in coordinating these efforts. Many NGOs, for example, have selected to work in areas where access might be low. And we need to know this so that we bring it, because things are happening and it might not be as abject as it seems.
All right, I'll come to you, Professor Qiyamah. How has the COVID-19 pandemic impacted your revenue?
Yes, it has affected in a very big way, because you see, initially there was no learning for 2 weeks, and then we had to try to build momentum again to ensure teaching and learning takes place. There were still people who adopted this method very fast, and the others who needed to watch and see how it goes before they can join. We continued motivating and training and encouraging, and then we started getting revenue coming in the university. The main revenue for the University of Nairobi is through the fee-paying students. And this covers about 75% of our budget. The government is only able to provide about 25% of the budget. So it is without that learning, without these fees, there will be no university, unless the whole model of financing university education changes, particularly for University of Nairobi. So it affected us in a big way at the beginning, and that is why we sat back at the Senate and said, wait, if we just fold our hands and we do not return life into the university, then even after COVID, there will be no University of Nairobi. And this will be the most irresponsible thing that the Senate can do. So Senate said, no. We must ensure that our staff and our students are engaged, because then our students are running, our staff are active, and then revenue begin to come into the university. So we were affected at the beginning, but then after that, we starting to get corrections happening. Not 100%, but like we would do in normal time, but yes, we do, to be able to meet the minimum expenditures that we require to meet to ensure the university remains alive.
All right. Professor Ngondo, I'd like you to come in at this point. When Dr. Ruto was talking about, and she talked about the cloud and all this potential, what happens to the teacher in the rural area, perhaps, who's not on the radio teaching kids, or who doesn't have, or rather doesn't teach in a school that has access to Zoom? What happens to them?
Thank you very much, Olive. I think that is a very good question. And I think I want to say, when we closed schools, it came as a shock, and therefore teachers had not been prepared earlier on what to do during that time. And the next reaction then was to try to strengthen the technology platforms for teaching. So what happened is that the teacher seemed to be left to be on holiday, so to speak. I think now that we are absorbing the shock, it is time to bring the teacher on board. Let's reflect upon the time before COVID. During holidays, teachers would always give learners assignments that they would look at after school. I think now it is time for teachers to regroup, so that then we can see how do we engage our learners who are on holiday from a distance. But I want to go further and suggest that we can be more creative in engaging our teachers. Teachers are people who are very creative. They are people who are trained in diverse methods. And we can, if we can get out of just the instructional approach, and as I said earlier, ask teachers wherever they are to see how they can involve learners in their schools through communication with their parents, through their phones, giving tasks, reviewing work, but also they could be involved in reporting to the schools next to them, and learners could be encouraged to go there in numbers that are possible to accommodate, and teachers can give some guidance. As I said earlier, I live in Eldoret, and just around where I live, there are about 3, 4, 5 secondary schools. If learners who live around those schools could be encouraged to register, and that registration need not be physical, to register in those schools, teachers who are around those schools are also encouraged to register around those schools. And then once we know the numbers of learners around there and the teachers who are around there, learners can be asked to go to those schools in turns, say once a week, and be given support that builds upon what the KICD is offering, support that builds upon any texts that the learners may have. And that might be an opportunity also to start having those learners borrow some of those texts that they can go and use at home for 2-3 days, come back to school and get more input, so that teachers start to get involved. So yes, in a nutshell, my answer is, let us try to start involving teachers so that they can support the parents. Even if it is just at the level of asking a group of parents to go to a school to be guided by teachers on how they can support their learners at home. That will be a contribution that the teachers will have made. Because the situation we have now is that parents are trying to educate their learners, to teach their learners at home, but without any guidance on where those learners were when they were at school, and therefore how they might support those learners to make progress from where they are. Allow me to say also that the teachers would also have more innovative ways of engaging learners around them. This is the time to have some of those learners engage in storytelling, engage in educative games, engage in creating music, creating drama within respectable distances, using other spaces, not necessarily schools, like churches, like public halls, like in Eldoret here, we have the municipal hall, which is now vacant, using some of those spaces where teachers can, from within a safe distance, engage children in useful activities, value-based education, environmental conservation, hygiene and health, and so on. So yes, I think it is time, as we think about June coming on, to start think about how to involve the teachers. I'm sure they'll be very happy to start offering their skills in supporting learners, engaging them from where they are. Thank you very much.
All right. Thank you, Professor Ngondo. Dr. Ruto, speaking of teachers, have you received any submissions? I know the deadline is tomorrow. Have you received any submissions from the teachers' unions?
The analysis is going on. We will be able to tell you whom we have received submissions from. Like I told you, there are a couple of thousands and all coming through the email address that we had shared. And the only thing I can tell you at the moment is that we have very many Kenyans in their individual capacity who have sent their submissions. And then we have institutional responses. So those will be analyzed, and we will share the full details of who has shared their submissions. And they will all be given equality of treatment.
Have you sought them out?
As I said, analysis is going on because we are closing tomorrow. Once we close tomorrow, we have developed our analysis framework. Within a couple of days, I'll be able to share that. If you want, you can invite me and I will share who has shared their submissions. But we are very encouraged that very many institutions and individuals shared their views, and that is very important because we want to capture the voice of Kenyans.
All right, but you acknowledge that theirs is a critical voice as well. Dr. Ruto?
Yes.
I'm saying, but you acknowledge that theirs is a critical voice as well.
Oh, indeed, indeed. The teachers' voices are very critical. In the literature we are reading, it is stated very clearly that when you are talking about planning when schools might reopen, even when schools have reopened, the teacher as a constituency needs to be engaged in a very critical manner. So they are very critical. So are parents. The literature we are getting is that if you wanted to children to start going, you might start with the youngest because the mortality rates amongst the youngest children is very low. But which parent would really be happy to let a preschooler go to school? You know, they feel they protect them. So parents are also very important. It's not just about science. You have to look at various other things, and every stakeholder to me is important, and every effort must be made to reach, engage. And that is why this is a moment in which we have welcomed, and I'd like to use this opportunity to say there is still a day tomorrow. Please do share your submissions. It is very important that you present your voice. It matters.
Okay, and for those who want to get in under the wire, how do they do that?
There is an email address, and I wish any of your members, it is, I don't know it offhand, COVID-ERC, I think, at KCT. There's an email address that we shared, and if any of your colleagues would beam it, I think that would really be great, because there is one day we have to close the submissions tomorrow to be able to do what we need to do in terms of advising the Cabinet Secretary.
Right, I'll come back to you for the last word, but Professor Qiyamah, final words quickly. What should be our takeaway as far as education is concerned moving forward, given how COVID-19 has impacted learning?
This has come and has brought to us that we need to invest on technology, particularly the access to data and the internet, and to make them cheaper for our people to access the information. We need to do this for all parts of the country. At the beginning, you played a clip where the president himself said that the government has encouraged the Google and Telecom to bring the balloons and ensure that all parts of this country have access to data, to internet. This was a big thing for the country. And I hope and pray that we will ensure, as we move forward from this, that all parts of the country, our people can be able to access internet, because the issue of the moving for the industrial revolution, digital access, the issue of access to information wherever you are, the issue of having data, that will be the life for the Kenyan and for everybody in the future. So this is an awakening for us, for the government, even for the universities, that we must invest in this space.
All right, thank you, Professor Qiyamah. Dr. Leting, I'd like you to come in to answer the same question. In your mind, what are the takeaways from COVID-19 moving forward as far as education is concerned?
Thank you very much, Olive. Again, my takeaway lessons out of COVID-19 is the fact that we need to improve the way we share information. And I think I like what the government has done. It has quickly adopted virtual learning. And I remember directives that came from the head of public service that we now need to adopt the virtual communication. Even board members are able to have board meetings using Zoom or virtual learning throughout. So my take on this is that in terms of education, this is a time now we can adopt it. And just like Dr. Sarah Ruta said, We need KICD as a digital literacy component or competence skill that is being espoused or being taught to the students, both especially in basic education. So what we need to do is to encourage the partners like telecommunication companies, media houses to support delivery of information through e-learning or through process of virtual learning. That way, we are going to develop leaders, people who are able to adopt and leverage on technology to communicate, to share knowledge, or to adopt knowledge. I'm aware, for example, institutions or universities that have adopted e-learning platforms where they teach through e-learning platforms and examine students through e-learning platforms, open book examinations, and such kind of things. That is the way to go. At CASNEP, we are going to be adopting webinars. We have adopted webinars to teach our students to revise for examinations, and in the future we are going to have online examinations where we shall administer computer-based testing of examinations that are for our professional graduates. And for basic education, I think one of the things I can just say is recommend that probably one of the things that the KICD will need to do now is to make a calling to teachers who have some knowledge of digital literacy to be able to participate in the development of programs in KICD, because the capacity and the demand for the people there, for the peoples. Yeah, we are talking about 15 million people in Kenya who are in basic education, and about 1 million, about half a million in university and half a million in mid-level colleges. So all of those people, if they can adopt technology, we may move from paper-based examination or learning to paperless learning, and that is the way to go, as that's the global practice. And I said earlier on, perhaps the government in its assessment can be able to, in responding to this issue of COVID-19, is be able to adopt some of the best practices, because we are not the first country to have been affected by COVID-19. We can learn from other countries, as I said earlier on, like Germany, that have been able to have a staggered approach to learning. And they have been able to start from top down, and they have been successful. Others have started from bottom up in terms of lower basic education upwards, but they can be able to, I think a middle ground, a blend of both systems can be adopted so that we can, at the same time, without taking all of them. And I propose, for example, that we need to have, yes.
Okay.
Thank you.
Okay,
Yeah.
Dr. Liting. Dr. Ruto, I asked for comments, and a lot have come in as far as exams are concerned. I know you told me you've received submissions and you're doing analysis. Is when the national exams should be conducted part of the things that you're considering as a committee?
Indeed, as many others. Like I said, please allow us to do the analysis. I think it would be wrong to be giving any opinions now, because those would be my opinions. I want to be fair to what literature is saying, to what Kenyans is saying, to what the specialist studies we have commissioned from the health sector are saying. Then that will be a good, balanced, robust opinion to offer at that time.
All right, thank you very much, Dr. Ruto. That is Dr. Sarah Ruto. She is chairing the committee that's been tasked by the CS of Education, George Magoha, on the new normal as far as COVID-19 is concerned, and how we can get to what we know as normality. We've also been joined by Professor Qiyamah, who's the Vice Chancellor of the University of Nairobi, Dr. Liting, who's the CEO at CASNEB, as well as Professor Ngondo, who is an Associate Professor at the at the Moi University and Faculty of Education. That's it for the Nation Leadership Forum. We'll continue the conversation online. The hashtag is NMG Leadership Forum. The handle is @NTV Kenya. My name is Olive Burrows. It's been a pleasure to host you.